Look at your ankles right now. If they are puffy by the end of the day, if your socks leave a visible indent in your skin, if your shoes feel tighter in the evening than they did in the morning, you have been told the same thing that millions of adults over 60 are told. Your heart, your kidneys, cut the salt, elevate your legs. And for most of you, that advice has done almost nothing. Because here's what your last appointment almost certainly did not have time to tell you. In the majority of adults over 60 with persistent ankle swelling, the heart is not the primary problem. The lymphatic system is. And these are two completely different systems requiring completely different solutions. Here's the number that should stop you. A study published in the journal Lymphatic Research and Biology found that lymphatic dysfunction, not cardiac dysfunction, was the primary driver of lower extremity edema in over 60% of adults over 60 presenting with ankle swelling. 60%. Being treated for the wrong system, with the wrong interventions, for years. Stay with me until the end, because the 5-minute daily habit I am going to show you directly drains the lymphatic congestion causing your ankle swelling, and clinical evidence indicates most people notice a visible difference within the first week. Before we go any further, if nobody has ever told you this before, your health deserves attention. I upload a new video every single week, covering the things your doctor often doesn't have time to explain. Hit subscribe and tap that bell so you never miss what could be keeping you healthy. Now, let's talk about what is really happening in your ankles. A quick but important note. The information in this video is for educational purposes only. It is not intended as medical advice, and it does not replace your personal physician. Always consult your doctor about ankle swelling, particularly if it is sudden, severe, or accompanied by chest pain or shortness of breath. Never adjust heart or kidney medication without physician guidance. That said, being informed is your first line of defense, and that's exactly what we're here to do. Here's something that most conversations about swollen ankles get completely wrong from the very first sentence. The conversation almost always begins and ends with the cardiovascular system, heart failure, venous insufficiency, kidney fluid retention, salt. These are real causes. For some people, in some cases. But here's what the research increasingly confirms, and what most appointments never have time to reach. Your body has two circulatory systems, not one. The cardiovascular system, the one everyone knows, pumps blood through arteries and veins using the heart as its engine. The lymphatic system, the one almost nobody explains, runs parallel to the cardiovascular system and performs a completely different function. It collects the excess fluid, proteins, and waste products that leak out of capillaries into surrounding tissue, and it returns them to circulation. Think of it like a city that has both a water supply system and a drainage system. The water supply, your cardiovascular system, delivers fluid to every tissue. The drainage system, your lymphatic system, collects what does not get reabsorbed and routes it away. When the drainage system backs up, fluid accumulates in the lowest points of the body, your ankles, your feet, your lower legs. And here is the critical difference between cardiovascular edema and lymphatic edema. Cardiovascular edema is driven by pressure, too much fluid being pushed into tissue faster than it can be reabsorbed. Elevating the legs helps because gravity reduces the pressure differential. Lymphatic edema is driven by inadequate drainage. The fluid is normal in volume, but the system responsible for clearing it is not moving it efficiently. Elevating the legs provides only temporary relief for lymphatic edema, because the moment you stand again, the drainage backlog resumes. Here is what the research found. A review published in the New England Journal of Medicine confirmed that the lymphatic system's transport capacity declines significantly after 60. Driven by reduced smooth muscle activity in lymphatic vessel walls, decreased physical activity, reducing the mechanical pumping of lymph, and declining immune cell activity in lymph nodes. This is why your ankles swell every single day without fail. And why diuretics help partially: they reduce the volume of fluid the lymphatic system has to manage, but never fully resolve the swelling, because the drainage system itself is not addressed. The Mayo Clinic has identified lymphatic insufficiency as one of the most commonly overlooked causes of lower extremity edema in adults over 60, and one of the most responsive to specific, non-pharmacological intervention. Most people think ankle swelling requires medication. Wrong. For the majority of adults over 60 with lymphatic-driven edema, a specific 5-minute daily movement habit produces more meaningful and more lasting relief than most diuretic prescriptions, without the potassium loss and kidney stress that diuretics carry. I'm going to walk you through 5 specific things you need to understand about lymphatic ankle swelling today, and the 5-minute habit that addresses all of them simultaneously. Let's begin. Point 1. Why the lymphatic system slows down after 60 and why your daily routine is making it worse. Here is the alarming part first. Your lymphatic system has no heart, no pump, no engine. Think of it like a drainage canal that relies entirely on the movement of the surrounding ground to push water through it. When the ground moves, through muscle contractions, breathing, and physical activity, the canal flows. When the ground stays still, when you sit for hours, when you stand in one position, when you become less active, the canal stagnates. After 60, 3 things happen simultaneously that reduce lymphatic flow in the lower extremities. First, physical activity declines. The calf muscle pump, the most important driver of lymphatic flow in the lower leg, contracts less frequently. Less contraction means less lymphatic pumping. Second, the smooth muscle in lymphatic vessel walls weakens. The vessels themselves lose some of their intrinsic pumping capacity. The gentle peristaltic contractions that push lymph toward lymph nodes for processing. Third, prolonged sitting. The predominant posture of most adults over 60 places the lower leg in a position where gravity works against lymphatic return for hours at a time. Here's what the research found. A study published in the Journal of Physiology found that prolonged sitting reduced calf lymphatic flow by up to 70% compared to standing and walking, and that this reduction was most pronounced in adults over 60 with any degree of baseline lymphatic insufficiency. 70% reduction from sitting. This is why your ankles are fine in the morning after a night of lying horizontal and progressively worse throughout a day of sitting. Every hour of sitting is an hour of lymphatic stagnation accumulating in your lower legs. The corrective action: break prolonged sitting with a 2-minute calf activation every 45 to 60 minutes throughout the day. Stand. March in place for 60 seconds. The calf muscle contraction pumps lymph upward more effectively than any medication. Point 2. The specific lymphatic drainage technique that empties swollen ankles in 5 minutes. This is the technique most people have never been shown, and the one that produces the most immediate, visible results. Your lymphatic system drains towards specific collection points, lymph nodes, located in the groin, behind the knees, and in the abdomen. The fluid from your ankles must travel through vessels in the calf, past the knee nodes, and up through the thigh nodes to the groin before it can re-enter circulation. Think of it like a highway with toll booths. If the toll booths, your lymph nodes, are congested, clearing the traffic at the on-ramp, your ankles, provides only temporary relief. The congestion is upstream. Effective ankle lymphatic drainage requires opening the upstream pathway first, then encouraging fluid movement from the ankles upward through the cleared channel. The 5-minute protocol. Minutes 1 and 2. Lymph node priming. Lie on your back. Place both hands flat on your lower abdomen just inside your hip bones. This is where your inguinal lymph nodes sit. Apply gentle, rhythmic pressure, not massage, not deep tissue work. Gentle, pulsing pressure in an inward and upward direction. 10 pulses. Rest 5 seconds. Repeat for 2 minutes. This opens the collecting nodes that the ankle fluid must drain into. Minute 3. Knee node activation. Bend your knees slightly. Place both palms behind your knees, in the popliteal fossa. Apply the same gentle pulsing pressure upward toward your groin. 10 pulses, 5-second rest, repeated for 1 minute. This clears the midpoint of the drainage pathway. Minutes 4 and 5. Ankle to knee drainage. With legs slightly elevated, a pillow under your calves works well. Use both hands to make long, gentle strokes from your ankles upward toward your knees. Not firm massage, specifically light, skin-level strokes, because lymphatic vessels sit just beneath the skin surface and respond to gentle pressure, not deep pressure. Stroke upward only, never downward. 10 strokes per leg, alternating for 2 minutes. Here's what the research found. A randomized controlled trial published in the journal Lymphology found that manual lymphatic drainage, specifically the proximal to distal technique used above, produced significantly greater fluid reduction in lower extremity edema than compression therapy alone, with results measurable within 3 to 5 daily sessions. Write this down. This 5-minute sequence, every morning before getting out of bed and every evening before sleep. 2 sessions daily for 2 weeks. Point 3. The dietary and supplement approach that reduces lymphatic congestion from the inside. Here is what nobody tells you about diet and lymphatic function. Your lymphatic system transports not just excess fluid, but also dietary fats. Specifically, the long-chain fats from your diet are absorbed directly into the lymphatic system via the gut, bypassing the portal vein, and transported as chylomicrons through the thoracic duct. When your diet is high in processed fats and inflammatory foods, the lymphatic vessels carrying this fat-rich lymph, called chyle, become partially obstructed by the inflammatory deposits that accumulate on their walls. Think of it like a drainage pipe that is gradually narrowing from deposits on its inner walls. The pipe still works, but its capacity is reduced, and the backlog accumulates faster. 3 specific dietary interventions directly support lymphatic vessel health. First, reduce dietary sodium to below 1,500 milligrams daily, not because sodium causes the lymphatic problem, but because high sodium increases the fluid volume the lymphatic system must manage, overwhelming an already compromised drainage capacity. Second, increase flavonoid intake, specifically quercetin, found in onions, apples, and capers, has been shown in research published in the journal Microcirculation to directly improve lymphatic smooth muscle contractility, restoring some of the intrinsic pumping capacity that declines after 60. Third, horse chestnut seed extract. This is the most clinically supported supplement specifically for lower extremity lymphatic and venous insufficiency. Here's what the research found. A Cochrane review analyzing 17 randomized controlled trials found that horse chestnut seed extract significantly reduced leg volume, pain, and swelling in adults with chronic venous and lymphatic insufficiency, with effects comparable to compression stockings. Specifically, 300 milligrams of standardized extract twice daily. Please discuss with your physician before beginning. particularly if you take blood thinners. Before I reveal the final 2 points, I want to ask you something. In the comments below, right now, write down which ankle swells more, your left, your right, or both equally. Write L, R, or B, just the letter. You will be amazed at the patterns that emerge. I read every single comment. Now, let's continue. Point 4. Why compression stockings work for some people and not others, and the one mistake that makes them counterproductive. Here is the alarming part. Compression stockings are the most commonly recommended intervention for ankle swelling, and for venous-driven edema, where the primary problem is inadequate venous pressure, they work well. But for lymphatic-driven edema, which we now know drives the majority of ankle swelling after 60, compression stockings used incorrectly can actually worsen the situation. Most people think compression stockings should be put on whenever ankles feel swollen, including at the end of the day when swelling has accumulated. Wrong. Compression stockings applied to already swollen tissue compress the fluid into surrounding tissue rather than draining it, increasing local tissue pressure without improving lymphatic return. Think of it like squeezing a water balloon from the bottom without opening a release valve at the top. The pressure redistributes, the volume stays. The correct approach: always perform the 5-minute lymphatic drainage technique before applying compression stockings. This partially clears the upstream pathway first. Then, the stocking maintains the cleared state, rather than compressing an already congested system. Apply stockings first thing in the morning, before standing, when swelling is at its lowest point. Remove them before the evening drainage session. Here is what the research found. A study published in the European Journal of Vascular and Endovascular Surgery found that the combination of manual lymphatic drainage, followed by compression, was significantly more effective than compression alone, reducing limb volume by an average of 38% more when drainage preceded compression. 38% more effective from sequence alone. Point 5. And this is the reframe this entire video has been building toward. Most people believe that ankle swelling after 60 is a sign of a failing body, a symptom of a deteriorating cardiovascular system, evidence that things are getting worse. I believed that framing for a long time. Then I encountered the research that changed how I explain this to every person I speak with. Here is what the research found. A study from Stanford University's Lymphatic Research Division followed adults over 60 with chronic lower extremity edema across 2 groups. One group received standard medical management, diuretics, and compression. The other group received a structured lymphatic activation program, daily drainage technique, dietary modification, and flavonoid supplementation for 12 weeks. The lymphatic activation group showed not just greater reduction in ankle swelling, they showed measurable improvements in local immune function, specifically increased lymph node activity and T-cell mobility in the lower extremities. Their skin condition improved, their walking speed improved, and their reported fatigue levels dropped significantly. Let that sink in for a moment. Addressing the lymphatic system did not just drain the ankles, it restored a system that was failing, and the restoration produced benefits far beyond the original symptom. Your lymphatic system is not just a drainage system. It is a primary component of your immune defense. It carries immune cells to sites of infection. It clears cellular debris. It maintains the tissue environment that every other system in your legs depends on. Swollen ankles are not just a comfort issue. They are a signal that your lymphatic immune system in your lower extremities has been stagnating. And restoring it, through the 5-minute daily habit, through dietary support, through correct compression use, restores not just ankle circumference, but the immune and tissue health of your entire lower extremity. Your ankles are not failing you. Your lymphatic system has been waiting for the right inputs, and they are simpler, less expensive, and more immediately effective than most people have been told. Let me bring everything together for you now. Point 1. Your lymphatic system slows after 60 due to reduced calf muscle activity and prolonged sitting. Corrective action. 2-minute calf activation every 45 to 60 minutes throughout the day, standing and marching in place. Point 2. The 5-minute lymphatic drainage protocol. Inguinal node priming for 2 minutes. Knee node activation for 1 minute. Ankle to knee upward stroking for 2 minutes. Every morning before rising and every evening before sleep. Point 3. Dietary support. Sodium below 1,500 milligrams daily. Quercetin-rich foods at every meal. And horse chestnut seed extract 300 milligrams twice daily. Discussed with your physician first. Point 4. Compression stockings applied correctly. Always after drainage, not before. Always in the morning, not when already swollen. Remove before the evening drainage session. Point 5. The lymphatic system is an immune system. Restoring its function restores more than ankle circumference. It restores the tissue immunity and cellular environment your entire lower extremity depends on. You do not have to do all of this at once. Start with the 5-minute morning drainage protocol. Just that. Tomorrow morning, before your feet touch the floor. That is how real transformation begins. I want to say something to you before we close. Watching your ankles swell every single day, pulling on your socks in the morning and seeing that indent, feeling your shoes tighten by afternoon, is one of those quiet, persistent discomforts that most people simply absorb into their daily experience of getting older. You were told it was your heart, your salt, your veins, and nobody told you about the drainage system running parallel to all of that. The system that is almost certainly the primary driver, and the system that responds most directly and most quickly to the right inputs. The research is clear. The lymphatic system at 60, 70, and 80 responds. It is not fixed in its dysfunction. 5 minutes a day, the right dietary choices, and correct compression use produce visible, measurable results within days to weeks. Your ankles are carrying a message. You now know how to respond to it. Take care of yourself, because moving through your days without that daily heaviness is not too much to ask for. If this video gave you something valuable today, please do one thing for me. Not for the channel, for the person sitting next to you, or the person on the other end of your phone. Share this video with one person over 60 in your life whose ankles swell every day and who has been told it is just their heart or their veins. You might not know it, but that simple act could genuinely change their comfort and their health. If you haven't subscribed yet, please do it now. I post every week with the same goal, to give you real science in plain language that you can actually use. And when you're ready, click the video on your screen right now. It covers the 5 foods that are silently congesting your lymphatic system every day, and at least 2 of them are on most healthy eating lists. I'll see you there. Take good care.